1 in 8 people in Scotland are on an NHS waiting list. The example I gave this morning is 2 constituents, both needing a hip replacement, both suffering for that. One is able to get £15,500 together and go and get it done privately, and that's them sorted. The other cannot afford that. The knock-on effect that's having on that person's mental health, the knock-on effect it's having elsewhere. So in terms of these waiting lists, what we actually going to do is there regional planning going in, health board by health board? How are we going to get these waiting lists down, and how are we going to address the knock-on effects that these unacceptable waiting times are having on people's health and well-being?
These are absolutely legitimate questions, and I'd be the first to acknowledge that waiting lists are larger and longer than they were before the pandemic, but that is a direct result of the pandemic. So there's no health board in the country wants to put off tackling these waiting lists. But obviously we have to be mindful of the presence and the prevalence of COVID. We are anxious to expand the capacity to be able to address the very issue that Mr Rowley fairly puts to me.
But should we not be saying to each health board that they need to identify exactly what the demands are in their area and start to bring forward some kind of proposal on how they're going to do that?
Well, that's what I would contend the NHS Recovery Plan does, because it focuses entirely on that issue of making up for the treatment that has been lost because of COVID. And each health board is under an obligation with a plan that they've had to submit to the Health Secretary about how they're going to go about doing that.